So you've been to the eye doctor, you need cataract surgery. What do you need to do to make sure you have the best outcome possible? Let me tell you. So you and your eye doctor decided cataract surgery is the best way for you to have the best possible vision. What do you need to know to make this successful? Number one, you need to optimize your ocular surface. We call this ocular surface optimization. Let me explain to you what this means. So when you have cataract surgery, you have to decide with your eye doctor and your eye surgeon what kind of implant you're going to get put in. Are you going to see just good at distance, or do you want to see far away and close up? These are decisions you will have to make. Now, in order for them to work, you have to have very precise measurements. What we found is if your ocular surface, if the front of your eye is not healthy, if you have a poor tear film, these measurements are inaccurate. This can lead to the wrong lens being chosen, the measurements being off, and your outcome not being as ideal as you want. You may have to wear glasses for distance and close up again. These are things that we want to avoid, and you can help avoid this by optimizing your ocular surface. In addition, even after the surgery, if you're not taking care of your cornea, your prescription can change and the outcome can be bad. So you have to do everything you can to keep the ocular surface healthy as possible. So how do you know if you need ocular surface optimization? Let me tell you some of the common symptoms. And these symptoms will happen before you've even had the cataract surgery. They happen in your day-to-day life. One is fluctuating vision. Things are clear and then they're blurry. If you blink a few times, it makes things more clear. This is because your tear film is unstable. That leads to an unhealthy ocular surface. When you're at your optometrist's office, they're going to do tests that can test for inflammation. They can see if the corneal surface is regular. Tests that we do are MMP9 inflammatory tests. We do topography scans of your cornea to make sure there's no irregularities. Also, something as simple as putting in a yellow fluorescein dye can tell if there's any damage currently on that ocular surface. Now, if your optometrist sees any of these things, you are a great candidate for ocular surface optimization. The best part about that, insurance will cover this in most circumstances. At my office, I like to use amniotic membranes. They're regenerative, they heal your cornea, and they last 3 to 6 months after treatment. So with my patients, once we decide to have cataract surgery, we will have them come in, we'll treat one eye first, the other eye a week later, and then they are ready to go. They'll lubricate their eyes with artificial tears. Sometimes we use ointment at night. There's also things that we can do in office that aren't amniotic membranes, that are drops that do the same thing. It really depends on your specific circumstance. But we are here to make sure that you have the best possible outcomes when it comes to cataract surgery. So whether you have dry eyes, you take other medications for other conditions, or you have fluctuating vision, make sure you ask your optometrist if ocular surface optimization is necessary before you have cataract surgery. If you learned something new, like, subscribe, and we'll see you in the next video.